how quickly somebody's immune system recovers back towards normal after they've completed treatment, and if they've got a blood cancer that's in remission, depends a bit on what type of blood cancer and a bit on what type of treatment. So the answer is, like almost everything we talked about this evening, it's complicated. As a general rule of thumb, people who've had something like lymphoma treated with chemotherapy, we think that their immune system is generally back towards normal by about 6 months to a year after they complete treatment. If you have something much more intensive, like a stem cell transplant, then it generally takes over a year, which is why we revaccinate people for things like childhood illnesses a year after a stem cell transplant. If you are having continuing treatment, say, so many of the people who have lymphoma treatment, for example, will carry on having what's called maintenance rituximab over a couple of years, then we think your immune system will stay suppressed during all of that time and probably for a year or so afterwards. And the basis for saying that is that we see that people who are having maintenance rituximab treatment are more prone to getting virus chest infections in the winter in normal times. So it varies a bit according to how intensive the treatment has been and how long it's gone on. And of course, it'll vary also according to what sort of blood cancer you have. So I talked about lymphoma, but I think leukemias may be a bit different, and maybe Pete should comment on that.
Yeah, I think I agree entirely. And the issues, I think, for certain of the leukemias, such as, well, certainly CLL, chronic leukemias, and myeloma, which are B-cell diseases, that the disease itself is immune suppressing, and some of the treatments we use are more immune suppressive than some of the lymphoma therapies. So certain chemotherapies, or certainly some of the targeted treatments. So I think the evidence we have is that the immune deficiency, if you like, after treatment with some of those therapies can last longer than, for example, for some of the lymphoma treatments. So my take on it would be that the further out, if it's a chemotherapy-based treatment that you've stopped, then the further out you are from treatment, the more likely you are to have a normal immune response, assuming you're in remission still. And some of our chronic diseases, you may not be in a good remission, and we have evidence that the depth remission helps from an immune response perspective in chronic leukemias. So I think that's the first thing to say. Some of the chronic therapies we use for these diseases will suppress the immune system, and the evidence is it does. And someone mentioned before, the myeloma and certainly CLL patients on treatment are more at risk with this disease. And then finally, I would say that some of the patients who are on early watch and wait, even without treatment, are probably immune suppressed as well. So even it's not necessarily just the treatment, the disease itself can likewise cause a problem. So I don't think one size fits all is the issue.
That's a really good point, and I think we'll come back to watch and wait in a little bit. Emma, did you want to add to that?
Yeah, and I just, with my sort of transplant consultant hat on, there may be a few of you out there who've had either an autologous or an allogeneic transplant. And I think actually, as Peter and Pete have said, it's very individual at what stage after your treatment your immune system gets back to normal. And we know for some patients after bone marrow transplant, they genuinely have a completely normal immune system and they're in remission. And, you know, I've had discussions with patients advising them originally when the shielding letters went out just to everybody who'd ever had a bone marrow transplant ever, even if they were 15 or 20 years post-transplant and completely well, for example, that actually they didn't need to shield. They had a normal functioning immune system. They weren't on any medications. Whereas there are other patients who may have problems after their transplant, like graft versus host disease. They're on treatments for that, and they will be more at risk. And I think most of the autologous transplant patients who have who remain in remission, we would expect that your immune system to be pretty normal, actually. So again, I think if you are worried about that, ask the doctor looking after you or one of the team looking after you, because they'll give you a feel for how recovered your immune system is.
So I just give a shout out for the non-cancer patients, because there may be some patients with aplastic anemia, which is we use very immune suppressive therapies for, and some diseases where it's not as immune suppressive. For example, with PNH, we don't think it's as bad, or MDS, myelodysplastic syndrome. So I think that the point that Emma makes is we should ask your specialist or the team, because they will give you specific advice to your own situation.
Gill, please.
And I was just going to echo what Peter and Emma has said about seeking advice for your situation, because we are all very different. And as Emma has said, do apologise, I'll put my teeth back in. We have patients who are on particular treatments for graft versus host disease post-transplant. And I'm really fortunate that I'm not in that situation, but I also know that I've have a particular issue with picking up respiratory diseases, and I don't react particularly well to viral diseases. And that's sort of been my recent medical history. So with that in mind, my medical team have advised me to be pretty careful and to keep safe and keep shielding. So that's it's going to be very individual for everyone. So just really please just seek advice from your medical team, and they're the experts and they really know you as an individual.